I think at the beginning, I was a little confused. I have a family history, strong family history of Alzheimer's, so it wasn't that it was a shock, it's just that it was happening to me. It's taken us several doctors to really get a definitive diagnosis, even though living with it, you know what is going on, at the time. So it was, devastating knowing how your life is going to go and how your life is going to end.
Perfect, thank you. Perfect. So maybe tell me a little bit about when your doctor or doctors shared the diagnosis with you. What did you think they did well?
I think once I had my initial neuropsychology screening and got that report, which showed mild cognitive impairment, I knew at that time that it was going to progress because of my mother and her sisters. The doctors seemed to be very reluctant to give you a diagnosis other than mild cognitive impairment. So it's taken me 2 or 3 doctors to get finally a definitive diagnosis. And it was hard. It was hard to accept that. I think it was difficult for them to say that. They were very reluctant to talk about it.
Did you feel like that they clearly explained to you what the diagnosis meant?
No. No, I do not feel that. The neuropsychologist that did the initial testing did not explain anything. He said I showed a little bit of depression and didn't really explain what mild cognitive impairment was. When I went to my to my primary and gave him that report, they immediately wanted to start medication and everything, but didn't really explain what was going on or what was going to happen.
What are some things that you think the doctors could have done better?
I think that they need to feel comfortable talking about it. I think they are, at least my primary care physicians were uncomfortable talking about it. They didn't want to cross the line from mild cognitive impairment to dementia, which we all know that's where it was going, but they were very reluctant to talk about it.
Did you hear things like a touch of dementia, or did they even use the word dementia? What type of language did they use?
No, actually, they did not use dementia. They did not say Alzheimer's. It was mild cognitive impairment until about a year ago. So it was about 3 or 4 years in before one of the doctors said that, dementia, and wrote that down on the chart.
And what's some advice that you would like to give doctors on how to share this diagnosis?
I think that it would be helpful if they were probably a little more versed in it, were a little more comfortable. I found that my physicians were not comfortable with the diagnosis or saying the word, the D word or the A word. They were not very comfortable talking about that. I think maybe a little more education, knowing how to talk to patients, knowing that that's not really a bad word, and that they could, comfortably talk to us about it. I found that my physicians were uncomfortable and sort of danced around the issue.
Great, thank you. What are some things that you think they should not do, absolutely, like things that irked you that doctors did when they were talking with you?
Like I said, they danced around. They didn't want to talk about it. When you have other physical issues that they're dealing with, such as your, high blood pressure, cholesterol, thyroid problems, anything like that, they tend to gloss over the dementia part and, talk about your other issues. I think, eye contact, talking directly, being knowledgeable about it, and, being compassionate and caring when they talk to you and try to explain it. And to take the time to do that.
Thank you. Great. And so when you left the office after them giving you diagnosis, what kind of questions did you still have when you left the office?
We were probably one of the lucky ones because we were referred to outside resources, like the Alzheimer's Association and a geriatric center that would, help guide us and give us support groups and everything. But yes, I still had questions as, how long, where do I go now? What am I supposed to do? Can I still do this? So there were a lot of still unanswered questions, and there still are a lot of unanswered questions today.
Can you do that again for camera?
Okay.
Sorry.
So yeah, well, about this, what other questions did you have still?
I think we had, a few questions as where do we go now? What do we do now? I did have one physician that referred us to the Alzheimer's Association and referred us to a geriatric testing center that offered a lot of needed support, explained a lot of things to my husband and I. But yeah, I think even to this day, we still have questions about, what's going to happen, where are we going to go, how is this going to end? I think we all know that, but it's still questions that it would be nice for someone, a physician, to sit down and talk to us compassionately and explain to us, how the process goes.
Absolutely, thank you. So these next couple of questions are sort of like, after the diagnosis, now you're moving forward. Are you going to say something?
No, go ahead.
More about now, okay, how has your doctor supported you? So, what do you want to know from your doctor about what to expect?
I think I'd like to know, I know with everyone, we're all different, and I've seen that in our support groups, and we all progress at different rates and at different times, but it would still be nice to know what's going to happen. I don't want a physician to tell me in 8 years you're going to die, and many have heard that. But I would like for him to say, go through the different phases and the different stages and what's going to happen.
What resources has your doctor or doctors given you that have really helped you?
The best resource that they gave us was they referred us to a geriatric center that has support groups. They have helped us immensely, and of course they've referred us to the Alzheimer's Association, so we've been able to do support groups and interact with other people that are in the same situation that we're in.
Great, thank you. Are there any other things that you wish your doctor do to help you cope with your diagnosis on a day-to-day basis?
No, there really isn't anything that I think that they could provide that could help us cope any better besides the knowledge that they, give us or that they should give us. I think as far as coping, it's an individual. We cope. My husband and I cope differently than other people in our support groups that are going through the same situation.
Great. And have you been overwhelmed with information by your doctor?
No. Like I said, unfortunately, they are lacking in information. At least my physicians were, lacking in information. And I think the information that they gave was to refer us to different organizations to help us out.
And your favorite section now about communication.
Yes.
So, when your doctor is talking to you, what helps you to better understand what she or he is saying?
If he would stay off the computer. I find, technology now, I remember when I worked in family practice and we did many mentals and all this stuff, and at that time physicians wrote in a chart or remembered it and went back to their office and dictated it, and now everything's computerized, and while he's talking and while we're trying to talk to him, I don't have his attention. He's not looking at us, and he's, typing on the computer, putting his notes in as he's listening to us. But I feel the eye-to-eye contact and to sit there in front of us and just be with us and not anything else at the time would be the best way to handle this.
Great, thank you. Great advice. And do you have you ever had the experience where maybe the doctor wasn't talking to you, they were talking to your husband? Maybe you can tell me a little bit about that.
Yes, I think a couple of the physicians that we saw when we, went in and talked to them about it and everything, when they, were talking about the problems I was having, they seemed to be addressing more to my husband than to myself. A few times I would direct questions to my husband because I didn't know the answers, and that was fine. But I think when they're talking to us, looking back and forth at the both of us is, would be helpful, and not just talking to the partner.
Great, thank you. And what helps you remember what the doctor has told you?
The best thing that helps me remember is that I have my husband who writes down everything that the doctor says. So his notes, and when we get home, we go over those notes. He keeps them. They're on our computer. I can go back and review them because I don't remember. I just went the other day and made a chronological log of the physicians and the diagnosis and everything. But I think you need to have someone with you to listen and to hear, because you are not always at that point that you are receiving the information that you need to. It may be your condition, or it may be that you're still in shock. So I think having someone there that can take the notes and can talk to you later about it is invaluable. I would recommend that you never go to a physician by yourself.
Great, thank you. And any other advice you have for doctors about how to talk to you?
Now, like I said before, I think just the eye contact, to pay attention, not let anything else get in the way, and I think that shows compassion and that they're interested. And I'm lost.
No, that was perfect. That was perfect, Sharon. Perfect. And last question. Anything else you would like to tell your doctor about what it's like to have dementia? What do you think they should know about what it's like to have dementia?
I think that it would be nice if they understood what basically we're going through, and that our brains are not always functioning properly at the time of the visit, that they need to be compassionate. I don't care for someone to feel sorry for me. I would like for them to ask how I'm doing and what issues that I have. And I'd like for them to address, my husband. When you have a care partner there, the physician needs to address both of you with questions, and be honest and be realistic. I think the one thing that really helps, like I said, is when they move up closer to you. They're not standing on the other side of the room, and they're being honest, and you can see it in their eyes that they're not distracted, and they are there for you.
Perfect. Sharon, that was
Okay.
amazing.
Thank you.
You are a natural. You should,
Thank you.
seriously.
Thank you.
This was so perfect. Thank you so much. All right, Tom, you're up.
All right, cutting.
Of dementia, so the diagnosis wasn't a total surprise. It was pretty brief that when we did find out, but like I say, it wasn't really a surprise.
Okay, great. And when you think about how the doctor or doctors shared the diagnosis, what do you think that they did well?
Our doctor listened to what Sharon and I had to say about the history and the behaviors going on, and which was very good. They did that. They administered many mental, and moved forward from there.
Great. And this is sometimes the easier question is, what do you think they could have done better when they were talking to you about the diagnosis?
One thing that would have been really good for us to learn that first trip to our primary physician was that the brain is a really complicated organ, and diagnosing it is a long process. There's a lot of testing, lab testing, an MRI, there's things like that. It was never really laid out and explained to us that, this is going to take some time before we find out what's going on inside your head.
Great point, thank you. And what's some advice that you'd like to give doctors on how to share the diagnosis, the whole diagnostic experience?
I think they, like what I said previously about explaining that it's a process to dig deeper into what's going on inside your head, to let you know that, and don't rush into it. Wait, don't give them a prescription for medicine on day one. If there's a 60-day follow-up, it's a slow disease. It could wait.
What are some things that you think a doctor should not do when they're giving a diagnosis of dementia?
The doctor should be talking to you and not typing notes on the computer. The doctor needs to listen to what's going on and be empathetic that, your life is getting turned upside down that day.
And what are some, when you've left the office, like after visiting with your doctor, especially after the diagnosis, what are some questions that you still had?
The questions started coming maybe not on the way home, but a week later, 2 weeks later, as you're searching around, finding information on your own about what's going on. And it would have been nice if there was some concise presentation on that day one to understand that, you could have a chemical imbalance or a vitamin deficiency or something that an MRI is going to show that, it's not always Alzheimer's.
Let's jump to it's kind of after this diagnosis and coping with it and how your doctor has supported you. What are some things you want to know from the doctor about what to expect and how to prepare for the future?
I guess we'd like to know, how this is going to play out, what kind of testing is going to be involved, and that it's going to take some time. It was like, wham, you don't know on day one that you got a problem. They have to do testing. They have to do a lot of verification before you know what's really going on.
And are there any things that you would want to know about what to expect for the future? How much information do you want to know?
That's a hard one. I really can't think of
It's
anything.
a tough question. I know
Yeah.
everyone struggles with that, right? What are some resources that the doctors have given you that have been very helpful?
The doctor provided us resources to a local geriatric assessment center that was fantastic. They knew, and they were able to drill down and do additional testing that was needed to help with the diagnosis. And they also recommended us to the Alzheimer's Association, which is a fantastic organization that provided a lot of information, maybe more than the medical practice did.
Great. And what are some things that you would like the doctor to do to help you cope with this on a day-to-day basis?
The doctor, one thing we've learned is that a healthy lifestyle, healthy eating, we started up a gym membership to exercise, all these things. So it's good for the rest of your body. Maintaining a healthy body is good for your brain. And that's one of those things we did not find out from a physician. We found out from the Alzheimer's Association.
Right. And because, each person's different, each person experiences dementia differently, what advice or guidance do you have for doctors about how to give you the right information at the right time?
I guess, speaking of timing, don't rush into it. Say, hey, there's going to be some tests. It's going to take 60 days to be thorough about this. A diagnosis could be devastating. It could turn your life upside down and point you in the wrong direction if it's done wrong. And it's a slow disease. If it takes 30 or 60 days to get an answer, that's all right.
And have you been overwhelmed with information by the doctor?
No.
Underwhelmed.
Underwhelmed.
Sounds like. Let's talk about communication a little bit. So, when the doctor's talking to you, what helps you better understand what she or he is saying?
I think if the doctor's making eye contact, talking to us, I attend the doctor visits with my wife, and we're sitting side by side and share the attention 50-50 between the two of us. She's still a person. You don't treat her like she's gone.
What helps you remember what the doctor has told you?
I take notes. I come in there with a clipboard and a blank sheet of paper and fill it up every time and try to get as much down as what I say to understand it later on or show my wife later on or a week later.
And what advice do you have for doctors about how to talk to you?
Make eye contact. Share the time talking between the two of us. I'm sitting next to my wife, and she still understands what's going on, and talk to the both of us together as a team.
And last question is, what would you like your doctor to know about what it's like to have a loved one with dementia?
It's tough. You're the person. I've been married for 30 years. The person I'm, married to is going down a road a path we'd rather not take. It's tough, and empathy, and be optimistic. Just don't be down about it. Be optimistic that there are things you can do to extend it and have a good life.
Perfect.
Thank
you,
you.
Tom.
You're welcome.
Is there any other questions from Mary Martha from you that you want to ask anyone? I think we got great.
Yeah, I do too.
This was amazing. Thank you, Tom, so much.
Okay.
Yeah, it was pretty devastating for both of us. We knew something was going on for several years before she actually got her diagnosis. But we didn't know exactly what it was, and it took a long time. Went to a number of different doctors, and when we finally got the diagnosis, we were excited, I guess, to finally learn what it was going to be, because we were thinking this was something, now we know we can seek out treatment and we can fight it. And so it was devastating to find out what it was. It was a rare form of frontotemporal dementia, and then to be told right off the bat that there's no treatment, there's nothing that can be done, that was devastating news to us. So we're stunned.
When you think about how the doctor shared the diagnosis with you, what do you think he or she did well?
I think what he did well was that he gave us, finally, after years of searching, some accurate information, an accurate diagnosis of what it was. And that's something we'd been searching for a long time and did not have. So I think that was the best thing that he gave us. Just another second?
That's perfect.
Okay.
Yeah, 2 minutes, you can check your notes.
I'm already thinking about where that's going to fit.
Yeah, I know. Me too. If there's anything else you want to add, just go ahead and
Okay.
say it.
Okay. And you're going to ask me after that what they could have done better.
Yeah. So
Okay.
go ahead. What could I have done better?
Well, I mean, you want me to add
Yep.
for first what he did,
Yeah.
how could the doctor present, how could the doctor have better, okay. We were very glad to get the information that we did. The doctor was a researcher, and unfortunately his an empathetic connection wasn't his strong suit, and so we felt a little bit rushed. Like I said, we were stunned to get the diagnosis. It would have been nice to have some more time with him, to ask some more questions, to not feel rushed, and to feel a little bit more of a connection when we did that. He wasn't the only doctor that we saw later on. We were connected with a couple of different research programs at different universities, and another doctor that we saw at another university. Again, these doctors were great, in most ways. But this other doctor, when my wife Linda and I were talking to her, she started talking to me instead of Linda. And Linda was sitting right beside me, but she was kind of ignored and left out of the picture, and she felt that. And eventually, by trying to bring Linda into the conversation, the doctor, I think, caught on. But for a good while, it was directed, all the conversation was directed to me, and Linda was kind of left out of the conversation.
I hear that a lot.
Okay.
What is some advice you would like to give doctors on how to give a diagnosis of dementia?
I'd say don't rush. I know doctors have a limited amount of time that they can meet with patients, but maybe plan ahead for a little bit extra time. Even another 10 minutes or so would have been good, so we don't feel rushed. I'd say if a doctor knows that that bedside manner is not the strongest suit, if he or she knows that that maybe the patient could benefit from a little more of an empathetic response, maybe consider bringing in a colleague, a nurse that is that way, or another doctor, someone that can help provide that support that people need when they get that diagnosis, because it really does knock people off their feet.
That's a great suggestion.
Let's see.
Is there-
I would also say to engage with the patients, ask questions, try to really make a connection with the people you're talking with. At that moment, people are just they're not together. They're not thinking. They're just kind of stunned. So. Providing resources is a big part of it. And it might help for doctors to learn a little bit more about this diagnosis. And I would think, in particular, this would be helpful for primary care physicians that are working with people. They may not be the diagnosing physician, but primary care physicians play a big role in this. And if they can learn a little bit more about the diagnosis beforehand, that can go a long way to helping people. Also, I would say schedule a next appointment with them right away. And if it's not going to be an appointment with them, maybe make that referral right away. Just keep them connected, because they're going to walk out of the room. And a lot of questions are going to come after they leave, and they're going to need that, and they're going to need resources. So,
What are some things that you think a doctor should not do when they're giving a diagnosis of dementia?
I'd say don't rush, don't leave the patient and caregiver hanging. Let them keep them connected with resources that they'll need. Make that connection with the person. Don't like I said before, if empathy is something that maybe is not their strong suit, plan ahead to have someone else there to help with that, a nurse or someone else that can help provide that empathetic understanding.
When you first got the diagnosis, I'm sorry. Go ahead.
There's one other thing I thought about too is realize that this isn't a diagnosis for a cold. this is a life-changing diagnosis, and maybe treat it with that gravity, because it will change people's lives in a very serious way. So, again, that may go to providing a little bit extra time and the empathetic understanding.
When you first got the diagnosis and when you left the office, you know, what are some questions you still had when you left the office?
Like I said, we were numb, we were confused. We didn't know what the next steps were, although the doctor in his office did have all that information for us, but we were, like I said, we didn't know what questions to ask. We were just so stunned by this because we walked in thinking that we'll get a diagnosis. Now we can get treatment. Now we'll know what to do. And so after that initial shock wore off, we started to regroup and think, well, what can we? There must be something we can do. We'll look at clinical trials, and we looked at clinical trials around the country, and in hopes that would do something. We needed hope, and eventually we learned that. Even though we got into several clinical trials, none of them were going to be able to stop what was happening, and so that was a whole different process of going through that was challenging for us.
Can I ask a clarifying question?
Yeah.
Gary, maybe you can talk about, because it was really important. It sounded like you were stunned with the diagnosis because you thought you were going to get a diagnosis,
Yeah.
but then there would be some treatment.
Yeah.
And so that was part of the being so shocked, was there was no treatment.
Yeah, we thought there would be some kind of treatment that we could get, and there'd be some way to deal with this, and there just it turned out there wasn't, and I guess we had to go through the process of checking out clinical trials and that sort of thing for that finally to settle in, because we just, like I said, we needed hope at that point. And it's a process of being able to really accept that diagnosis. It takes time.
Great, thank you. So let's talk a little bit about after the diagnosis and kind of coping with it and what's next. And, you know, what did you want to know from your doctor about what to expect, you know, how to prepare?
I guess what we wanted to know is, at that point, was, okay, what's the treatment? How do we fix this? And to be shifted onto another track right away that there wasn't a fix took time to understand and to really come to grips with. So I guess at that point, we didn't get what we wanted from the doctor, but the doctor couldn't really provide what we wanted. But what doctors can provide, though, was to provide some patience, provide some understanding, support, and give, I would say, the patient and caregivers some connections to other doctors or Alzheimer's Association or other people that are working in that field to help them to adjust to things.
Yeah, any other resources that really have helped you?
There have been a lot of things that have helped. Like I said, it's a long process of coming to grips with what the diagnosis is. You want to try to fix things still. You want hope. You check out clinical trials. You check out this. You check out that. the doctor may prescribe some medications, but as of now, there's no medications that will change the disease. They may maybe lessen the severity a bit for a time, but I'd say the things that helped were our primary care doctor was an important part of this. Our primary care doctor wasn't the diagnosing doctor, but he took time to learn a little bit about the disease, and all through the course of this, I mean, it was 12 years between diagnosis and when my wife passed, and so initially she was, she was very able to ask questions, and she was just missing a few words here and there. But a lot of things will happen in normal life. The colds will happen, illnesses, and there's reasons to go in and see the primary care doctor, and so that became a positive aspect where he could kind of check in from time to time and see how she was doing, see how I was doing as a caregiver. That was helpful. So having that connection with the primary caregiver or the primary physician can be a real important factor.
What is something that maybe you wish that the doctor would have done to help you cope?
I think we got pretty good support from our primary care physician. He was both my wife's physician as well as mine. So it did feel good to have him check in with both of us to see how we're doing. And he was there through the whole process. Shortly after diagnosis, he was brought into the picture, and he was there for the whole 12 years and continues to be there for me. And it's trying to gather my thought here. Had something that flew away. What was the question? What he could have done?
Yeah.
It's okay if nothing comes to mind.
I had-
what
I had-
you were saying was great.
I had a
so-
good I had a good point. I just
To clarify, is it what could the primary care physician have done or the diagnosing physician?
Either, but I think primary care probably,
Okay.
yeah, would be, yeah.
So checking with me was important to me. Okay, I know what it was. And that connection with the primary care physician was not only helpful for me as a caregiver, but very helpful for Linda. I remember reading a study that talked about how people with dementia will sometimes they will lose an understanding of who a person is and what the context they know a person in. Yet they might still have an emotional memory that goes along with that. And so that seemed to certainly be the case with the doctor. After a while, she didn't understand exactly where we were or exactly who the doctor was, but she knew that she liked him. She knew that going to that office was a pleasant experience for her. And so she would smile when we would walk into the office, and she would smile at him broadly when we would meet with him. And so that was important. And all those connections that she had were critical, I think, to help have her feel positive on a daily basis. Connections with friends, connections with family, and that doctor was a big part of that. And she would, like I said, she would smile when she walked in the office. She would smile at him. She didn't seem to know why we were there or exactly who he was, but she knew that she had a connection with him before, and she liked him. So it was important.
Thank you. That's a really important point. It's important for doctors to hear that, certainly. Because each person is different and each person experiences dementia differently, what advice would you give doctors about kind of how to give the right information at the right time?
Yeah. It varies. There's a saying among people that work with people that are dealing with dementia that if you've met one person with dementia, you've met one person with dementia. Of course, the meaning there is that everyone is unique. Even with the same diagnosis, people have different backgrounds, there are different personalities, and so it's not going to be the same thing for every person. So I think it's important for doctors to tune in to the patients and not just treat them broadly as you're going to treat one person differently than another person. One person may need medication at one point where another one necessarily want. So each person is very much an individual, and there's not a broad brush you can paint this whole thing with. It goes for caregivers too, not just the patients.
Absolutely. Have you been overwhelmed with information by the doctor?
I don't think we were overwhelmed with information. We're fortunate enough to be connected with a couple of research programs where a lot of information was provided to us. We also got information through the Alzheimer's Association, through the Center for Excellence Aging and Lifelong Health. There were a lot of different organizations that were there for us to give us information. So I don't think I was ever overwhelmed. But I could see how it might be possible for somebody to feel overwhelmed, especially in the beginning when they're just learning about this. So that's an important point for I think doctors, just to give people a little bit of time, but do that follow up with them. Make sure that they're connected and that they're not just wandering out from the office and not having any idea what to do.
So the next few questions are about communication. So when the doctor is talking to you, what helps you better understand what they're saying?
I think what helps me better understand what they're saying is to use ordinary language, not too many technical medical terms, to be willing to explain things, to be patient, to give a little more time, and certainly empathetic understanding. That goes a long way. If someone is feeding me a lot of information and they're not patient, then I may tend to feel overwhelmed, and I'll forget to ask questions. So again, I guess having that patience with the patient and the caregiver is an important thing.
And what helped you remember what the doctor told you?
It helped me to take some notes. It also helped to have information provided to me. When we left the diagnosis, we left with a packet of information that I was able to read through later and start to help me to understand more accurately. The research programs that we're a part of also had a staff that we would be connected with that we could call with other questions. It would have been nice to have had a little bit more support from those programs, but they were located in different cities, and it was not something that was easy for them to provide long distance. So I think it's important to have some connections locally. with Alzheimer's Association or some other organization like SEAL that can help provide that support. We Linda and I used a lot of programs that helped us along the way. We were involved in one program together that involved both caregivers and people with dementia, and that was really important for both of us. And Linda really looked forward to those meetings. We had little notebooks that we would take with us, and she'd go gather the notebooks on that day and bring it in, so that she got a lot out of meeting with other people, and that having that social connection for her was important. We did that as long as we were able to, as long as she was able to. And then there were other programs that we're a part of where we called it a memory cafe, where we would go and the same kind of situation, but there wasn't any formal program. It was just a get together with other caregivers and people with dementia. We could all just sit around and talk, and there wasn't any kind of pressure. If anyone said anything that seemed a little unusual, that no one cared. It was just a good way to get together and support both of us. So we took advantage of a lot of those kind of programs, and it was helpful. Toward the end, we were involved with hospice, and hospice was a good experience, a good positive help to us. And I think a lot of people don't think ahead to that, but bringing them in at one point can be a beneficial thing.
Thank you. Those are great resources. What's some advice you would like to give doctors about how to talk to you?
I think, like I said before, patience, a little empathy, talking in plain language, those sort of things. Yeah.
And did you ever feel like there were times when you wanted to speak to the doctor separately or privately, and kind of how did you approach that, or did the doctor ask you?
There were a few instances where that happened. I would generally try to ask questions and talk in front of Linda. I didn't want her to feel excluded, but there were some things from time to time that I needed to know that I thought might be a little upsetting to her. In that case, I would call up later and talk to the doctor. That's another point too, is being available to the patient and the caregiver for those kind of questions, following up that they may not do together.
And I guess, my last question I have is, what would you like a doctor to know about what it is like to be living with dementia, caring for someone that has dementia?
It's something I never expected. At this point in our lives, Lynn and I had a lot of plans to be traveling and doing a lot of different things together. Life has taken a dramatic turn in a direction we never thought that it would. I was in a situation where I was lucky enough to be able to care for Linda at home for the 12 years between her diagnosis and when she passed. And life changed dramatically during those times. There was a period where Linda started, at first she could walk around the neighborhood and on the paths and so forth, and she loved to walk, and that was fine. She could do it without any problem. After a while, she would leave the house and she would walk into neighbors' houses without knocking, just walk in. And so at that point, we had to make some changes. We had to put inside locks on the doors. For a few years, I was literally locked inside with her every day. A very big difference from the life I had had before, that we had had before. There were also some, I would say, some growth, some spiritual changes on my part that happened. I would change things in a minute for Linda's, on Linda's behalf, that she would never have to go through this. But as far as what I was able to learn and the way I was able to grow through this personally, I wouldn't change anything. It was a horrible experience in many ways, but in many ways, I came out of it loving her in ways that I never could have imagined before. So if you look for the good, I think you can find the good.